Welcome, everybody, to our May Monthly on Mondays series. We're really excited to have all of you here today. And today's topic is navigating the academic journey with family support. And in today's Monthly on Mondays, we have a wonderful panel to present the different parental leave policies and give you updates on what's going on at the School of Medicine. So today we have Sheetal Desai, who just finished being interim chair of medicine, division chief of rheumatology, and she's going to talk specifically on a project that she developed through while she was in executive leadership for healthcare on lactation. We also have Ilona Pack, who is part of our UCI main campus and is the director of academic policy part of academic personnel. We have TJ Kennedy, who's our compensation plan manager, and we also have Thuy Vu, who will be assisting and just giving some feedback or anything that we miss. And she's from our Office of Academic Affairs. So we have a lot of experts here today. And what the format today will be is each of them will give a short presentation and then we'll do question and answer. You can either put the questions in the chat and Brian and I will moderate, or you can raise your hands. And so I know Dr. Desai has to leave early. So we're going to go a little bit out of order just to make sure she can present because her topic is really important. So Dr. Desai, I'm going to turn it over to you.
Thank you. I'm going to go ahead and screen share. Can you see the application?
Yes, we can.
Okay, perfect. Let me put it in official mode. Thank you so much for inviting me over here and really excited to speak to our group on this topic that I feel really passionate about. Please let me know if for any reason the audio cuts out or if you can't see the slides. I will give an update on lactation support here at UCI Health as we've had a lot of exciting changes in the recent year. So just some updates for everyone on facts about lactation. My daughter is in college and my son is in high school. And back when I was having kids, lactation was recommended by the American Academy of Pediatrics and the American College of OBGYN for a year. Well, in 2022, that changed where AAP updated it to 2 years, and that followed suit with ACOG, increasing the recommendation to 2 years as well in 2023. And it's because there's multiple benefits of lactation to the baby with decreased risks of infection, allergic conditions, atopy, SIDS, diabetes, obesity, and leukemia. And there are multiple benefits of lactation to the mother with decreased rates of diabetes, hypertension, breast cancer, and ovarian cancer. When it comes to data on lactation in physicians, given the length of time of training and the age of women when they start working, childbearing and lactation is a very common occurrence. When we look at the data over now decades of physician mothers and physician moms groups on Facebook and other areas, women could not breastfeed to 12 months. 40% of them couldn't even make it to 12 months. 60%, over 60% of them made it to 12 months, barely, but many could not. And the top reasons cited was inadequate time to do so, schedule and flexibility, patient care demands and workload, and associated financial losses. And as you can imagine, all of us being in healthcare, this is something we strongly encourage all of our patients to do because of the multitude of benefits to both them and their child. And being in our industry, we should be able to support it for our physicians as well. When it comes to rates of physicians leaving clinical care, specifically female physicians. This came out of the University of Michigan intern study, that a longitudinal study that follows interns in training and throughout training and after throughout the entire United States. And this has been going on now for close to a decade. They send surveys out to trainees after they have been in the workforce for years, and they actually accumulated data. And they found that 2 out of 5 female physicians after completing their primary residency, went part-time or left medicine altogether within 6 years of completing residency. So that was 22.6% of female physicians going part-time compared to 3.6% of male physicians 6 years after training going part-time. And the number one reason that was cited was family and work family conflict. And so the emergence of this gap so early on in female physicians' careers, you can imagine, can lead to later gender inequities when you're looking at compensation and promotion. So just some updates on the laws and policies on lactation. In 2022, Biden passed the Pump Act, which stated that employers must provide a reasonable amount of break time and space for nursing employees for up to 1 year after a child's birth. And if employee is not completely released from duty, then it must be paid. California has a labor code section 1030, which we actually follow under UCOP and the UCI policies of lactation, which states that all employers must provide a reasonable amount of break time for milk expression. The time may run concurrently with rest breaks. If it does not, then it needs to be separate. For non-exempt employees, it is unpaid time, and employers must make reasonable effort to provide space in close proximity to work. So this is a very quick overview on the laws and policies regarding lactation. And then looking at what the status of this is across the top 50 US medical schools. This was based on a study from a colleague of mine at UC San Francisco who used the 2022 top 50 School of Medicine World Report rankings and evaluated all of the top 50 US medical schools, of which UCI is one of them, when it came to their lactation support policies. It was actually verified from representatives from each of the medical schools. And they looked at dedicated space or equipment, accommodation resources. What I'm going to focus on here is they looked at financial incentives. How many of our top 50 US medical schools actually offered financial incentives or a payback system for the time that was lost while lactating? And it was only 4 of the top 50 US medical schools. This was released in October of 2023. The only one in California is UC San Francisco to our north, and they actually enacted lactation RVU credit in 2020, and UCI actually enacted lactation percent credit, which I will go over, in July of 2024. So we are now unofficially the 5th institution in the country of the top 50 to be able to offer financial lactation support. This was the SBAR that I worked on and provided at our CEO cabinet meeting with the work of many people, including Dr. Jeff Abbott, Randolph, John Gross, TJ, Greg, where we put a lot of the data together. And the focus was that, look, the background is there isn't financial support of lactation. A lot of our faculty are RVU based, and when they're RVU based and we support the time needed for them to actually lactate, it results in them having to choose between getting a salary or a bonus and the health benefits of lactation. And given all the data on the numbers of women that are unable to lactate out to a year, the numbers of women that have been going part-time or leaving the healthcare workforce across the country due to work family conflict, and all the policies on supporting lactation. We did an assessment of all the academic affairs data of all women across the School of Medicine between 2021 and 2023 that had gone out for childbearing or child rearing leave. We evaluated the costs to the institution, and as you would expect, the majority of the faculty were assistant professors, minority were associate professors that had gone out. We had no full professors. We evaluated a projected cost based on these numbers, based on taking a 30-minute session per every 4 hours or so of clinical time. And then we put together a cost analysis. We proposed this to the clinical enterprise, explaining that this could not be a cost This should not be a cost that is borne by the departments because women represent varying levels of faculty in every department, where you can imagine if this was borne by the departments of medicine, family medicine, pediatrics, OBGYN, classic departments that have many more women would actually bear higher costs than other departments that may not have a high percentage of women. So the recommendation was this is a cost that we would hope the clinical enterprise would take on centrally to be able to support lactation. And it was actually unanimously approved. And even before we had the processes to process this was approved in April, but they decided of 2024 that they would try to roll it out as quickly as possible to begin July 1st of 2024. It took months to put the process flow into effect, but they wanted to make sure that we could honor it. So the way this was actually approved was to support lactation for all UCI Health RVU-based faculty, because salaried faculty, for example, our CFTE faculty can take breaks and that may not adversely impact their income the same way as an RVU-based faculty. So phase one of this rollout, and this is a phased approach, while I'll go over the additional phases, but the first phase was to ensure that faculty salaries who are based on actually throughput and seeing patients, if they're on a work RVU model, that they would actually get credit for time taken for lactation. And the way that that was actually evaluated and built into this model was a 30-minute session in a 4-hour window. So that comes out to about 12.5% of their CFTE that we were going to go ahead and plan to pay back as a percent effort. Just to compare and contrast this, UCSF provides an average level 4 RVU amount of money to their faculty for every session. We decided that the RVUs will actually vary significantly, how much credit people get from department to department, even sometimes within divisions within a department. So we decided to do a straight percent effort. So faculty have, for example, a whole day of clinic, 8 to 5, and they take 30 minutes in the morning and 30 minutes in the afternoon, they will actually get credited 12.5% of their CFTE for that time. The process flow is that we want our women, before they actually go on maternity leave, to have this conversation at the same time they're having the conversation of the leave they would like to take with their CAO, their chief, and possibly their chair. Plan is to put clinic blockages in place as early as possible. So just to give an example, within the Department of Medicine, I met with every female that was actually planning on taking maternity leave before they went out on maternity leave to ask them if they were planning on lactating. And if they were, several months in advance, we went ahead and put the clinic blockages that they anticipated they needed, 10 to 10:30, for example, and 2 to 2:30 in their clinic flow. The CAO, they all have process flows that TJ can fill you all in on more to follow to be able to receive credit for their lactation time. Faculty were instructed, just for awareness for everyone, to contact clinical affairs at this website, let them know when they're returning to work, and then let them know that they're requesting lactation support. Clinical affairs then the team will work with department staff to submit a lactation time service now. The staff will go ahead and forward that to the School of Medicine Finance, and then that's how the funding will actually get evaluated, processed, and then flow back to the departments. So again, this is for your CFTE, the clinical time. So for example, if you're in a division where you're 60% clinical, 40% research, this would be applied to your clinic time, because that is the clinic time that is being blocked for you to be able to do lactation that adversely impacts your RVUs. So just kind of wanted to go over that. We first worked on, my focus of the project was on financial remuneration to our work, RVU-based physicians. But what we've been working on over the last entire year is evaluating our structural systems with lactation rooms across UCI Health. We have actually updated the website. I've shared the website here where you can actually go on and see, but I've done walkthroughs with a group of really dedicated, wonderful people on the team to look at our space, our equipment, the accommodations that we actually have in the room, ensuring that our existing sites in Orange actually have sufficient space and sufficient rooms. Please know that our new hospital and new clinic locations that are being built, it already is built into the business code for their floor plans. So every floor has a lactation room. But we went back and walked through Douglas and Tower and a lot of our UCI outpatient clinic sites. You're not able to see this, but if you actually go to the website, it's really hard for this to be clear. We have every site there. We have identified everything that each of the sites have, things that sites do not have and that are not ready for them to be lactation rooms, such as locked doors, frosted windows, appropriate, cleaning of the room, an appropriate chair, electrical in the room. We are actually putting through a budget and creating that budget right now. We're actually on the finalizing the budget, and we'll be requesting it from the clinical enterprise. And so some additional things are lactation pods as well for areas that are very impacted in Orange where we don't have the ability to add additional space. So I just wanted to let you know where we're going with that. But most of our sites all have space identified. We can always use more space, but we at least have space identified in most all of our sites. And like I said, to come, phase one was a rollout from the clinical enterprise to support our RVU-based faculty across UCI Health. Phase two will be to identify support of our staff physicians and department covered APPs. And then phase three will evaluate support of all UCI staff across the board. But we're going to be continuing to evaluate dedicated space, equipment, accommodations, and what resources we have here at UCI. And I'll go ahead and end there and open it up if you want for questions.
Feel free to post
Oh, yeah,
questions
I'll look
in
in
the
the chat.
chat, or you can also raise your hand and Brian and I can monitor.
And I have the chat open, Amisha, so I'm
Okay.
watching it in case we have anyone post on the chat.
Well, while we're waiting for someone who has a quick question, is what should faculty do if they encounter challenges accessing appropriate lactation space or getting accommodations?
Absolutely. I think the first part is talk to the clinic manager at the clinic site that you're at, because there are a couple of clinic sites that don't have the appropriate lactation space identified yet. And in the interim, all clinic managers have identified rooms that we can use in the interim period. So please, first and foremost, as we're growing at this exponential rate and we have a growth of our clinic sites, please talk to your clinic directors and identify if there is space in clinic. That comes to space and equipment, and there should be, because the goal is our number of 30 minutes per 4-hour session was based on having lactation space in close proximity to where you work. So if there isn't lactation space in close proximity, that changes a lot of our equation. But in all the walkthroughs I've done, all clinic spaces have an identified space, and it can also be the manager's office if they don't have a room in the short term. And there's only a couple of clinic locations that don't have a room, but the manager said that they will give up their office, so it's a safe, locked place. Great question. So that's space. If you have financial questions, the people you want to talk to is your division chief or department chair and your MSO, because they can actually work with TJ, Greg, and the team to evaluate that. Right? Great question.
Sheetal, we have a comment in the chat about milk storage fridge. Can you comment on that?
Right. So we had looked at the criteria for lactation rooms in general. The criteria is really somewhat vague on a national basis. So we kind of built from that and created criteria. Each lactation room may not have a fridge, but there has to be a fridge within the vicinity. So, for example, if you're in a private clinic, say UCI Tustin, the offices all have locked doors and our staff and faculty can use their offices for lactation. But that room does not actually have a fridge, but there is a break room within the clinic where there is a
Mhm.
fridge where they can actually store their milk. So all of these rooms don't have a requirement to have a fridge in the room, but our requirement is to ensure that there's a fridge in close proximity. Great question.
Dr. Sentel has a question.
Yes. Let me
I
see.
have I have a comment as well as
Hello.
a question. Dr. Desai, amazing initiative. I know how important it is for our faculty to be able to be recognized about the needs when they are actively taking care of another beautiful human being that they brought in, right? So this is wonderful. In terms of this work that you're doing with faculty, I also believe it's really an opportunity for our residents who are in these clinics, who are also within the fertility periods, might be able to access these resources through the same website that we have put together. Or has there been a difference between what the faculty can access or the residents can access? Is this lactation physical facilities available to our trainees too?
Absolutely are. So when I finished this project, I shared all the information with Kyle on. So he has it and the spirit. So these rooms are not just for faculty, they would be for staff as well. They would be for our trainees as well. But just giving you an example, the room that we had in one of our clinics in Orange was a storage closet that was constantly being knocked on while everyone was lactating over the recent years. So we really had to identify better space. The spirit is we should be doing the same process for our trainees. I shared all of this with Kyle, and so he said that in spirit, that should be the case, that what we do for our faculty, we should be doing for our trainees as well. It doesn't impact pay to them, right? For us to block their schedules, for them to be able to do these breaks, but it's absolutely important for them to have the same thing. And so across the Department of Medicine, I have shared that this is the same thing we should be doing for our fellows and residents. Kyle On is aware the same website is actually shared and on the GME platform as well. And
Thank you.
if for any reason it's not being carried out, I'm happy to have a conversation and share what we would like our intent to be, a kind of across the School of Medicine.
Oh, thank you. That's fantastic. I just want to address Dr. Yakamori's comment about or question about the storage fridge. I mean, as you know, we have worked on this as well. For our purpose of the trainees, particularly for surgical trainees, it's really hard because they are working for long times or long durations in the hospital. They really don't get out of the hospital for some time, for a whole day or so. So in the Douglas Hospital lactation rooms, there are refrigerators available for people to store milk that is outside of the usual break room fridge. So that's accessible to the residents or anybody who's accessing those rooms. There are fridges available in those specific dedicated lactation rooms for storage.
Some
Thank you
of the
again.
rooms do
Amazing.
have it. No, you're right. Some of the rooms have it, but we could not put it in all the rooms across all lactations. But for those reasons, I'm glad the Douglas ones do have it. Absolutely.
Sheetal, just
Yes.
along those same lines, you talked about how residents and fellows have the same access. There is a question from Dr. Atapur about, are there processes in place for the residents and fellows who are more so on like ICU or emergency medicine rotations where it may be a little bit harder to step away? Just, it's a good idea for the faculty to know what the process is so they can encourage their trainees along that. If you could comment about that.
Absolutely. So I'm not in charge on the GME side, but I've been a proponent to Kyle that we should have an official policy that mirrors our policy for faculty as well, right? So he's aware of that,
Right.
but we've not actually built that in completely. I've been waiting kind of for his lead. But when it comes to more of the CFTE physicians, even for not just us, the trainees, but for the physicians as well, that's why they're a part of phase two, because it may not actually impact their funding or their salary, but they might have different needs. So, for example, hospitalists, ER
Hmm.
physicians, or trainees as well, they might need a decrease in their census for the team if the attending is a lactating mother, for example.
Hmm.
And similar things might apply to trainees. We have not officially evaluated our salaried employees, which would actually trickle down to our trainees that are predominantly inpatient. I would say there's a lot of room for conversation here, and it would be important. We need to support anyone
Hmm.
that would like to lactate. And so we need to evaluate what that level of support would be and try to make sure we can incorporate it in their day-to-day activities.
Thank you. I know you
More of a
have to run,
general comment,
so
right?
yeah,
But
yeah.
right. So, but I told Kyle I would love for us to develop something really specific following this level of support for our trainees as well. Our union contracts, which I looked at, really doesn't have a lot of details,
Hmm.
surprisingly, when it comes to lactation. And in spirit, we would like to offer what we do for our faculty to our trainees as well.
No, that's
Dr.
great news.
Desai? Oh, Dr. Parekh, sorry to interrupt. I just wanted to let you know that when we were working with Dr. Dina McRae in terms of really looking about residents and their support for lactation, we created the best practice guideline for well-being for lactation support for resident and fellows based on her input, and we already have that document ready to go. So if it is something that you can partner with at this point with Kailan to make that is a universal policy, but this is something that we have acknowledged as an important universal policy that at least our GME should have it. I'm happy to send that to you. This is something that we want to get ahead for the residents. I'll send it to you.
Send that to me so I have it because
Mhm.
I know he's gone through a lot of things with the new hospital and the expansion. So if I have it, then I can actually work on it with him and we can see if we can make it official.
Yes,
Absolutely. Thank you for your work on that.
Well, I
thank you.
know you have to run, but thank you for
Thank
all
you.
the work on this. Very impressive.
Of
And
course.
it's an honor to be part of the UCI system where the folks behind the scenes are actually
Hmm.
making this happen. And we're number five
Yeah.
in
I want to
lifted.
say, five in 2025 is not a large number of the top 50 US medical schools. You would hope it'd be a lot higher, but so proud of the support from Jeff Abbott's team, from the finance team, from the clinical enterprise to really all come together and recognize this is very important for retention and recruitment of our faculty and for them to actually use clinical enterprise funding to support this across the School of Medicine. So I really want to give thanks to everybody that was a part of this process. And it's an iterative process. So we just wanted to begin, get our foot in the door, but there's a lot more that we have to do here. So thank you.
Thank you.
And any
Um,
questions, even after the fact, people can definitely email me. Happy to chat about it.
Thank you so much, Dr. Desai, for all this great work. Now we're going to switch gears and have TJ Kennedy present a little bit more detailed about just the leave policies from our Office of Academic Personnel. And then I think, Ilona, if you want to kind of comment too after his presentation from your perspective at academic personnel for a UCI campus. And I think
Alona,
TJ
I
has
think
some
Alona,
slides.
Alona will go first, and then she'll do the
Okay,
broad UCI, and then
she'll do the
I'll
broad. You want to switch it? No
jump in with
problem.
a few SOM
Thank
Okay.
specifics.
you. Thank you. Let me share my screen here. Oh, let me make sure. Can you see my screen?
We can.
And it's
Yes.
the full screen one, right?
Yep.
Okay,
Yes.
wonderful. Thank you. Good afternoon, everyone. I'm Ilona Pack. I'm from the Office of Academic Personnel, and I wanted to give you just a really quick overview of family-friendly resources that are available to you And I'm just going to touch on it just very briefly. And TJ will provide more as far as the process as in requesting these types of family-friendly resources, and a little bit more on the health sciences compensation policy as well too. So some of the things I'll be going over about childbearing and childrearing leave, active service modified duties, and stopping the clock. For child rearing leave, an academic appointee who is disabled because of pregnancy, childbirth, or related medical condition, they're eligible for childbearing leave for the period prior to, during, and even after childbirth. And childbearing leave may also be used for parental or prenatal care. During the childbearing leave and or pregnancy disability leave, no duties should be required by the university. And the paid leave, it's up to 8 weeks, and it would be the X plus X prime as far as the paid leave. And it's also concurrent with family medical leave, FML, if you are eligible for FML. And it's up to 12 work weeks of the childbearing leave that would run concurrently. For child rearing leave, it consists of 2 different leaves. So we have the parental bonding leave and or the parental leave. So for the parental bonding leave, it's granted to care for and to bond with a newborn child or a child that's been newly placed for adoption or foster care, and to attend any matters related to any of those for the birth, adoption, or placement of the child. It's also, it would run concurrently with FML as long as you're eligible for FML leave. And parental bonding leave, it must be concluded within 12 months following the birth or placement of the child or children. So parental bonding leave, it is a little bit more restrictive, and it's typically unpaid as well. For the parental leave, you just have to be full-time or part-time for parental leave without pay for 1 year to care for a child. And that's also unpaid. But there are paid mechanism option, which is PFCB, parental. It's paid for family care and bonding. It's for parental bonding leave and parental leave, since they're generally unpaid. But there is this paid mechanism option, and I'm sure TJ will go into it some more. But just in a quick nutshell, it's a paid option for up to 8 weeks per calendar year at 100% of the eligible earnings. And for faculty in health sciences compensation plan, PFCB, it interacts with the pay options available depending on your implementing procedures for HSCP and your or department specific procedures. And to be eligible, you must be on an approved block of family and medical leave, which is FML, for one of the qualifying reasons that's listed in the APM as well. And we've got these live links. These slides will be shared after the session today. And must be taking that leave in blocks of minimum of 1 work week. Those are the brief criteria of the PFCB pay options. Next, we have active service modified duties. This is a period during which the normal duties are reduced so that an academic appointee may prepare for and care for a newborn child or a child that's newly placed for adoption or foster care. And to be eligible for active service modified duties, an academic appointee must be responsible for 50% or more for the care of a child. So active service modified duties, or ASMD, it's not a leave. They're just modified duties. And this is, it extends from 3 months prior to and up to 12 months following the birth or placement. For childbearing appointee, they're eligible for a total period of childbearing leave plus active service modified duties, not to exceed the 3/4 of which birth or placement. And that first quarter of ASMD, it runs concurrently with the quarter in which a childbearing leave is taken. As far as all other academic appointees, they're eligible for a total of 1/4 or 1 semester of ASMD. And the reason why the childbearing appointees, they do receive the 3/4, it's for the reason to be able to recover after the childbearing months. Also for health sciences compensation faculty, as far as the clinical responsibilities, they may reduce clinical duties in lieu of teaching relief as appropriate. And this is also taken from the APM as far as what can be considered modification of clinical duties as well too, or reduction in percentage of efforts. But for non-HSCP faculty who have clinical duties, modification of those duties, it could be a reduction of clinical duties and an overall reduced workload. HSCP faculty members, they will receive pay no less than their approved base monthly salary, and any additional compensation under the HSCP would be paid in accordance to the school implementing procedures. So again, TJ will probably go into more details about that as well. We also have stopping the clock or stop the clock. So academic appointees, they may stop the clock during the probationary period to care for any child who is or becomes part of a faculty member's family. And to be eligible to stop the clock, the appointee would be at the assistant rank and must be responsible for 50% or more for the care of the child. And it's per birth or placement, and it constitutes like a single event. So if you could request stop the clock once or twice, and that would constitute like a single event of birth or placement. And for what reasons can you stop the clock? Well, for eligible faculty, there's for childbearing or childrearing. It could be for serious health condition, including disability or bereavement, or it could be for significant circumstance or event. And I know sometimes we get questions, well, what exactly is that? And it could mean a variety of things. I think like a few years ago, there was the COVID stop the clock, or it could be there was, it could be a flooding that occurred in the lab or whatnot that deterred any research productivity and being able to utilize the research facility. But as far as being able to stop the clock, what's important is submitting that notice of intent on or before July 1st, whether it's in which the MCA or the promotion is to occur. And MCA is your mid-career appraisal. So it's important to keep that date in mind as far as submission, and also completing the AP 92 form. And that's how you would submit your intent to stop the clock. Even when you do submit your intent to stop the clock, what's still required is that reappointments with or without a merit review, it's still going to occur every 2 years because your appointment is for only up to 2 years. And so it's required that you keep that timeline in place. But at the same time, you do have the option after you've submitted your notice of intent, you could still go up for your mid-career appraisal or your promotion review at normative time. Because what happens is that once we receive the stop the clock request, we also draft a letter. And in that letter, it's a chart of how the timing of your reviews would occur. And it also shows when your new MCA review would occur or when your new promotion would occur. And it gives you an idea. And if you choose, you know what, I'm ready, I want to go up normative time, that is definitely an option to still do, even though you have a stop the clock. So that's just a quick and brief overview for family-friendly policy, and we've got resources. These are links as well too that will also be available. So I'm going to stop sharing so I can see if there's any questions, because I know I went through them rather quickly.
Ilona, there is a question in the chat. Someone was asking, does 3/4 equal 9 months? Because in health sciences, it's a little bit different. So we wanted to ask that question to you.
TJ, do you want to clarify that for the fiscal year? Because it's usually like in 3 months increments.
I am not fully, because this is for the active service modified duties. I think the question was related
Yes.
to. I am not certain on that one.
Okay, so this is specifically for active service modified
Yes.
duties. Okay, let me just double check and then I'll put it back into the chat. Just I'm clear on the number of months. Any other question as I look into that as well too?
We don't see any,
Well, I
but
would
maybe question. But
ask,
Brian?
I can imagine faculty would want to ask without being named, are there negative career implications, perceived or actual, for using a stop the clock?
No, there are not. And in fact, that's also in policy as well too, that they would not be dinged for having a stop the clock. And even for promotion to tenure or promotion from the assistant to associate rank, as far as soliciting letters, external letters, we have updated our sample letters as well too, to be able to incorporate those family-friendly reasons, whether it's stop the clock or any other reasons, such as like COVID-19, things like that. So it's something where it's something that's available to faculty to utilize.
All right, good.
Ilona, I do have a question I wanted to ask on behalf of the faculty. What are some common mistakes you see that faculty make in regards to taking some of these leaves or preparing for these leaves?
I would say the best thing to do is seek advice early in time.
Okay.
Oftentimes, I think it's received after the fact, and if questions can be asked by the department staff personnel, or even to the dean's office, I know they have subject matter experts as well too. It's really helpful to assist faculty as far as what options do I have? Because oftentimes they're not sure what options they have. And to be able to be presented like, these are the options you have in advance, I think it would assist them in better planning, and also just be able to ask other additional questions they might have, because there are so many different leave options, and some of them they run concurrently with family medical leave, some do not, and so it's good for them to be able to plan ahead.
So I think specifically, question was, who should we reach out to? And I think we would say for School of Medicine, start with our Office of Academic. I would say first start with your MSO or CAO in your division or department. You can also check in with Office of Academic Affairs. And I think that would be my first recommendation to start. And then if needed, we can always go up to Ilona and her office and team.
Correct, because I think usually if something is unclear, right, the academic affairs team would reach out to their specific assigned academic personnel analyst in our office.
Wonderful. TJ, do you want to now kind of go more specifics on the School of Medicine and the HS compensation plan as it pertains to leaves?
Yes, let me share my screen.
We had a hand up if you want to type something in the chat, we can get it to folks, or just unmute yourself and ask while TJ's getting her slides ready.
Thanks, Dr. Cummings. This is Maud Aldacessian. I just want to jump in and say, in addition to your department CAO and MSO, if you don't reach out directly to your department analyst, your CAO or MSO hopefully will. So at the department level, you have academic affairs department analysts that are a good resource, and they have regular trainings and access to resources on things like the mid-career appraisal, stop the clock. We're just ramping up on our information on, the various things like PFCB and different things offered for family planning, but they're a really good resource too. And so I would start with them, and then they typically consult with the dean's office and to advise.
All right, so lots of places to get help. So thank you.
Yes,
TJ.
and I'll have one more slide as well at the end about a few more SOM options.
Cool.
So thank you, everyone. I'm TJ Kennedy. I'm the Health Science Compensation Plan Manager. I'm just going to build a little bit on Ilona's presentation for some of the SOM specific policies related to the comp plan for childbearing and childrearing. So we'll talk about the Health Science Compensation Plan policy, what the process actually looks like for you as a faculty member if you're about to go on a leave, a few of the related policies in the comp plan, and then the contact information and some of the subject matter experts here in the School of Medicine. So when we talk about health science compensation policy, there's really 3 levels that we're looking at. You have the UCOP policy, the Academic Personnel Manual, which Ilona had just gone over as well. A lot of those were from the APM 760. That is 8 weeks of X and X prime. And then each campus has implementing procedures on how the health science comp plan will be implemented at that specific university. And in that policy, it's up to 8 weeks of X and X prime as well. But each department also has a department compensation plan. And starting in fiscal year 25, the departments worked to expand their offerings with support of the enterprise on the ability to maintain TNS in their department compensation plans for the leave period. So I recommend reaching out to your department administrator, your chair, and talking about the options available in your department compensation plan. And just as a note, if a department compensation plan option is used, that will decrement your PFCB option that Ilona had talked about. And the PFCB option is at 8 weeks of base salary. So if the department compensation plan is at full TNS and you choose that option, it will take away the equivalent time of the PFCB. So for you as a faculty, I want to echo what Ilona said, is the earlier you can have these conversations, the better, especially with the complexities of School of Medicine and some of these in the clinical settings. It's just best to have these conversations early. So I would recommend always to start discussing with your department chair, your division chief, your administrator. Once it does come time to submit, you'll submit a request in EEC, the Employee Experience Center. And then from there, HR will work with you on the entitlement and pay options. HR, we work with for any update, for any entitlements or pay options in the department plans, we inform HR. And HR is really the expert when it comes to the entitlements, like FMLA, CFRA, and those different entitlements for the blockage of time that Ilona had mentioned. And if you're also eligible for lactation support or maybe eligible, you can contact the Clinical Affairs Office directly at the email for the process that Dr. Desai went over. And Clinical Affairs will help work with you in your department as needed to figure out the best situation. And there's a couple of related policies that come up or could come up during a childbearing or childrearing leave. One is vacation, because sometimes faculty will use vacation allotments to maintain TNS for if they run out of full TNS option, or if they're only at base salary, they can supplement with vacation to keep the full TNS. And then there's also, while faculty don't accrue sick leave starting January 1st, 2025, faculty do have 6 sick bank days per calendar year that expire December 31st each year, but it's another pay option that could be available. And then extended illness in our UCI implementing procedures, while not childbearing, childrearing, I just want to highlight it because it is another specific option in the health science compensation plan. And if eligible, that's 6 weeks paid at your base salary, your X and X prime, but you would have to qualify under an applicable entitlement. So when you have these conversations, I recommend your department as the first point of contact, but there are a lot of subject matter experts, our office and SOM Academic Affairs, related to the health science compensation plan and the academic personnel policy. We work closely with Ilona's office for any questions and situations that may come up. Human resources will be your first point of contact when you actually put together the leave breakdown, and they are also the experts on the leave entitlements. We work with their office as well to make sure we look at pay options and what is available per the department compensation plans. And then clinical affairs as well is crucial in the lactation support process. And if there's any questions about how leaves may impact clinical incentives or how it may, in fact, impact your clinic, clinical affairs will work with your department on that, because there is a lot of complexity regarding clinical incentives. So best to ask the questions early, or at least have the conversations, because you don't always know what questions to ask until you're back, and actually they may not come up until later, but just it's best to have the conversation early. So that was my quick presentation just to build on what Ilona said from the comp plan policy. Are there any questions?
TJ, you mentioned in fiscal year 25 starting January 1st that faculty have these 6 days for sick leave. How do they request that? Is there a policy or is there a process that they should follow?
Yes, so that's handled at the department level. Requesting, we did send out a guide, an FAQ to departments, because there are some questions that are specific that's not covered by the UC policy, especially for the clinical setting. The policy is new for all of us, so we're still working through it with Ilona's office as well. So if any questions arise, please let us know. But the actual tracking of it is handled at the department level. And there are certain situations that you can use it for. I don't have the full slides. I think, Ilona, you did a presentation is that available on the AP website as well? The one from earlier this year?
The
presentation that your office had done on the sick leave.
Yes. Let me get that link.
And TJ, can you kind of give us the history behind that? The sick leave, where it came from, and the work that was done on it?
For the sick leave?
Yeah, a lot of the faculty did not know about it, so.
Yes, so from my understanding, Ilona, you probably know this better, it was due to a California update in law. So it was across the UC, but it's effective January 1st. And it's six days each. You get awarded 6 days each January 1st. They expire on December 31st of that year. They don't roll over to the next year. So it's 6 days per year. It is paid at full TNS in the School of Medicine. But yeah, it is 6 finite days per year. And yeah, it was due to a new California law.
Thank you for sharing that. Any other questions from the group? You can either put it in the chat or just unmute yourself.
Yeah, well, so while we're waiting, I said, TJ, if you had 12 days of sick leave, you could use the new 6 days first and get 100% of your TNS. and then you'd switch to your other sick leave and get your X and X prime. Is that how that would work?
Well, because faculty don't have sick leave itself, but you could use the 6 days and then switch to the PFCB option, the pay for family care, which is at base salary. You could switch to the department plan option if your department comp plan has an option. A lot of these you have to meet the entitlement requirements. So this is HR will work with the faculty, and because there's a lot of different options, a lot of entitlements. So HR will walk through when you meet with them the different options, and they can do potential breakdowns on how maybe you do a few days of vacation to supplement some of the time. So they can do that full breakdown with you because it is very specific to each situation.
And what your series is and all of that.
Yeah. So they'll work with you through all the different pay options to make sure you think about the different pay and entitlements.
All right, so we do have a question. If sick leave is not used, is that paid out at the end of the year, like for nursing, ESVs, et cetera, or is it just disappear?
It just disappears at the end of the year.
All right, so use it or lose it, but you don't want to get sick either, so.
And TJ, can the sick leave be used to go for routine medical appointments as part of that?
It can, in the policy that Ilona link should have a little bit more details, but if it's something like that where it's routine, but you know beforehand, the department can require a certain notice period if it's unexpected. So for those foreseen ones, there could be an expectation to make sure you notify with enough time for the department to adjust as needed.
And I apologize. I think the PowerPoint presentation was supposed to have been updated, and I'm not seeing it on our website. So I'm going to follow up and find out what happened to it and provide the link. Once that's up on our website again, who should I send that link to?
They said that to Sophie.
Okay, I'll do that. Apologies. I'm not sure what happened there.
It probably had the word diversity in it or something, and so we had to make it go away. Diversify your stock portfolio, folks. That's all I'm suggesting. Any other questions tonight, folks? All right. Well, I want to thank our panelists. I learned a lot. I hope you did as well. Namisha?
I did. Thank you all for joining. And please do encourage your peers, other people in your department and divisions to watch the recording because this did have a lot of information, a lot of new information as well. So I think the most important thing, remember, reach out to your resources, start with your division and department. We have the MSOs, the CAOs, department analysts, and also in the Office of Academic Affairs. So thank you all for joining. We'll see you next month. Next month's Monthly on Mondays is going to be on how to do the paperwork for your merits and promotions. We'll be focusing on the AP 10 as well as some of the other statements that you would be needing to do. So we hope to see you then, and we hope you all have a good evening. Thank you.
All right.
And thank you again to all our wonderful panelists.
Yes, thank you.